Examining identity as a variable of health technology research for older adults is a systematic review that explores which older adults are included in health technology research, what methods are used to engage older adults in this research, and how different types of participation might impact equitable design interventions. Our motivation behind this systematic review was to assess how inclusive our research practices are across research with older adult samples. As prior literature states, there are various factors and considerations that go into technology acceptance and adoption among older adult populations. It is important to understand research approaches, methods, and samples involved in emergent health-related technology research. Specifically, we were interested in the following research questions. What are the trends in the types of research studies being published about the design of health-related pervasive and ubiquitous technologies for older adults? What methods are used in technology design across these studies, and in what ways are subgroups of older adults engaged in the design process? And lastly, which identity dimensions are reported and examined in health-related HCI research with older adults, and in what ways do HCI researchers understand and categorize older adults as end users? To address these research questions, we conducted a systematic review of full research papers published in two major computing databases. This review focused on the ACM Digital Library and the IEEE Explorer databases as leading repositories that publish research on technologies from human-computer interaction and a design perspective. We were interested in how the HCI community considers identity dimensions of older adult samples in health technology research, and thus limited our search to the top computing publication databases. We identified search terms in three areas of domain, population, and intervention, and filtered papers between January 2008 and December 2020. We focused our systematic review on the last 12 years of aging HCI and health technology research to examine recent trends of these research studies conducted with older adults. Since one of the focuses and main contributions of this systematic review is the trends of studies reporting identity variables across older adult samples, we wanted to focus on a time span around seminal papers that discussed intersectionality, identity dimensions, and diversity of users in HCI, such as the Schlesinger Intersectional HCI paper, published in 2017, and the Himmelsbach et al. Do We Care About Diversity in HCI paper, published in 2019. We limited our review to papers that focused on technologies used by older adults and not those used by others to monitor older adults. We excluded any papers that were not full research articles or proceedings. This led to a full text screening of 301 titles and abstracts where papers were removed that were either systematic reviews themselves, papers that did not focus on older adults as a sample, or papers that only discussed a framework or sensor system architecture. 174 papers met our criteria for final data extraction, and due to 12 of these papers describing one or more research studies, we report on 188 studies. So we structure our results in four main areas. The first being research approach, methods, and environment. So of the 188 studies, 109 were conducted as a qualitative interview or focus groups. 9 studies were reported as quantitative experiments and 39 as quantitative surveys. So a majority of these studies also reported as evaluative, where older adults were involved in the testing, evaluating, piloting, or demoing a prototype or interface. Only 9 studies reported being generative, in which older adults were involved in generating one or more concepts or designing, developing a prototype or interface. The second area of our results were the categories of technologies and devices. So we coded for types of technology and device as they were explicitly named by authors in the papers themselves. So robots were among the most mentioned technology descriptions and were directly referenced 32 times within the literature of these that we reviewed. These included descriptions such as assistive robot, social robot, and mobile service robot. Mobile phones were the most common device reported in 41 studies. The third area was population identity dimensions reported. So our results identify identity dimensions in three different categories: primary identity dimensions, secondary identity dimensions, and tech use characteristics, which we define in the paper. Age and gender were among the most reported, while dimensions like race or ethnicity or income or socioeconomic status were only reported in 11.7 and 3.7% of studies respectively. We also noted which papers reported intersections of dimensions such as race, ethnicity, education, and income, as these are dimensions that engage the unique experiences, attitudes, and linguistic nuances of various cultural groups. So only one paper out of the 174 reviewed reported the intersection of these dimensions, and 8 reported the intersection of race and education. The last area of our findings was trends in research from 2008 to 2020. A majority of papers we found were published in conference proceedings from either Pervasive Health, SIGCHI, or Petra. Looking at the papers and studies published across the span of our review, there was a slight increase in reporting on race and ethnicity between 2017 and 2018. We also saw that after 2015, more papers reported on income, although this prevalence was still low. We also noticed a trend in more papers and studies focusing on interviewing older adults or evaluating technology with them, with few studies doing co-design or concept generation. Our review serves to call to attention a major lack in understanding who we are designing for and the identity characteristics of users' aging research. While we did notice a slight increase in the reporting of certain dimensions over the years, such as race and income, these dimensions are still not considered valuable in our research culture. Findings from our analysis indicates the necessity and criticality of intersectional HCI, and it raises questions as to how well historically marginalized older adults are present and engaged in our research, and to what end are we perpetuating cycles of inequity and exclusion within HCI. Our findings suggest that many older adults with different experiences based on identities other than age or gender may be excluded out of conversations about health technology design. Given the potential impact of intervention-generated health inequities, we argue that we may be exacerbating the gap in access to health resources, and that we must reflect on how our research practices support inclusion and find opportunities to engage those who are currently not engaged. We encourage you to read our paper entitled "Examining Identity as a Variable of Health Technology Research for Older Adults, a Systematic Review."